Hi, good people. I hope you're well. Today, let's look at personal protective equipment. So, what's the main purpose of we having this personal protective equipment, also known as PPEs? So, we mainly do so as to protect yourself and the client from infection and disease transmission. That's the main purpose. That's why we use PPEs to protect yourself and the client from infection and disease transmission. So, personal protective equipment is always made up of, we talk of the gloves, we talked of the goggles, we talk of the mask, the gown, and also doing hand washing is also part of the package. So you'll always find there are questions that you'll always be asked about the sequence at which we wear or even remove. So wearing, we talk of donning, then removing is just removing. So when we are donning, now when we are wearing personal protective equipment, what's the sequence that we do? So when you are supposed to start with hand hygiene, don't forget about that. Then you don your gown. After donning your gown, now you can don your mask. Then after mask, that's when you do goggles. After goggles, that's when you do gloves. That's about donning when you are wearing. So you don't while you're not preparing yourself for the procedure. Let's say now the procedure has finished. So it means you cannot stay with the PPEs for a long period of time. So you're supposed to remove. Now what's the procedure of removing? So we start with the gloves because at this point they are the ones that are not that clean. They're always affected. Then next we go to the goggles. After the goggles, we do the gown. After the gown, we do mask. Then after mask, we do hand hygiene. That's about removing the personal protective equipment. So why should we do all this? We've talked of the aspect of protecting yourself and the client from infections. So there are infections that we do precautions, and we mainly divide them into three: with the contact, with airborne, and with droplet. So it means they are transferred throughout these methods, like contact. The other one we've talked of airborne, then the other one we've talked of droplet. So let's start with contact. So what are the diseases or the infections that are mainly transmitted through contact? So for this we use the mnemonic mist, MRS, then we do we, and the other one the way it's listed over there. So for contact precautions, we have multi-drug resistant organism. We talk of respiratory infections. We talk of skin infections. We talk of wound infections. We talk of enteric infections. We also talk of eye infections. Not forgetting varicella. Cutaneous diphtheria is also part of the contact precautions. Then herpes simplex, contact precautions. Then impetigo, pediculars, not forgetting scabies. That's about contact. What about airborne? We use the mnemonic MTV, don't forget about that. So it's measles, M for measles, T for TB, then V for varicella. What about droplet? We use the mnemonic SPIDERMAN. So you just remember the SPIDERMAN. That's all about droplet. So S stands for sepsis and scarlet fever, not forgetting about strep. Then P talks of parvovirus, pneumonia, and also pertussis. I talks of influenza. Then D talks of diphtheria. E talked of epiglottitis, droplet. R talks of rubella. So rubella is droplet, while herpes simplex is always contact. Then M talks of mumps, meningitis, mycoplasma. Meningeal pneumonia is also part of the droplet. Not forgetting adenovirus and also AIDS, HIV/AIDS, as part of droplet infection. So we do droplet precautions. Okay, so what's the standard precaution? So you're supposed to apply to all body fluid secretions, excretion, and mucous membranes. So hand washing, we do it before and after a procedure, and even when soiled. Okay, so we do hand washing in warm water vigorously. Okay, that's all about hand washing. So we've talked of the gown, the gloves, the mask, and also the goggles for eye protection. So don't forget about the sequence. We've talked of donning, we do hand hygiene, gown, mask, goggles, then gloves. Then removal, we start with the gloves because they are the ones that are much soiled. Then we do goggles, then we do gown, mask, then we finish with hand washing. So that is something about personal protective equipment. If there is any other question, you can just post it down. And for those that are new to the channel, we kindly ask you to like our videos, share. Don't forget to subscribe so that in case we release any other video, you'll always be notified for the better. Thank you.